on absolute binding free energy calculations. He then continued working on free energy calculations with Bert de Groot at the Max Planck Institute for Biophysical Chemistry as a Humboldt Research Fellow. He then moved to Canada in Toronto to work with Alan Asparu-Guzik as a Vector Postdoctoral Fellow, where he worked on machine learning and Bayesian optimization algorithms. Now he has recently moved to Boston to start a new position at MIT with Connor Colley's group. So we're excited to have him and look forward to your talk. Thanks, Matteo. And you're on mute still. There you go. Perfect.
All right, can you hear me?
Yes, we can hear you.
Thank you very much. Sorry for the technical issues.
No problem.
Can you see my screen?
Perfect. Yes, now we can see.
Perfect. All right,
Thank
here
you.
I am. Thank you again, Jonah. And thanks also to the organizers for giving me the opportunity to talk about this work today. As the title says, it's related to predicting inhibitor resistance in general, and more specifically, kinase inhibitor resistance. And this is really a collaboration and there are contributions from a number of different groups. So I will kind of talk about some of the experiments that came from Marcus Seliger at Stony Brook, some of the calculations and predictions from Vitas and Bird for the Max Planck, and also from Clara and Joe at Bayer, and as well as we had some help for the data analysis from John Codera at Memorial Sloan Kettering, and also from David and Andrea from Charité. So as I mentioned, the topic today is really about resistance, and we're interested in resistance because it really affects the durability of different therapies, and in particular, antibacterial and anti-cancer drugs are quite susceptible to resistance issues. And of course, there are many different mechanisms through which resistance can arise, but one of the major mechanisms is protein mutation, where the mutation effectively impact the binding affinity of the drug. So if we look more specifically at kinase inhibitors, these are some of the most important therapeutic modalities for the treatment of cancer. So as of 2021, there are 55 FDA-approved inhibitors, and there are many susceptible and resistant mutations that have already been characterized. But as you can imagine, there is a very large number of potential mutants, and so basically the majority of these mutants have not been characterized. So if we look at this plot on the right-hand side, this is an analysis from the Memorial Sloan Kettering Cancer Center, where they sequenced the DNA of about 10,000 cancer patients. And the takeaway message from this plot is really the fact that we have 68.5% of these mutations observed only once. So it really means that the majority of the mutations that have been observed in the clinic, they don't really have a precedent before, and they have not really been characterized at all. So to predict resistance at all, again, if we think about what we just mentioned about the fact that there is a very large number of potential mutations, most of them are not characterized. So from a drug design perspective, one might want to try and anticipate the likely resistant mutations that might arise in order to prioritize different drug candidates. And at the same time, one might decide to perhaps follow an orthogonal route where different drug candidates they might be resistant against different resistant mutations, and this could be combined into, or they could be one might start develop already second generation inhibitors. Perhaps a bit more in the longer term, one could think about clinical practice applications such as in personalized medicine, where perhaps we have a patient that comes into the clinic, and we can sequence the DNA, and we can see that there are a number of different mutations. And if we have a panel of different inhibitors, each of them with different efficacies against different potential mutants, we can try and select the ones that are most likely to show efficacy against this specific protein sequence. So because of this, there's already been some work done in this area. Here I'm highlighting two specific studies, one from Hauser et al. From Schrödinger, and one from myself, Vitas and Bert at the Max Planck. And this data set that I'm showing here was collected by Hauser et al. And it involves, it comprised 31 different mutations for human Abl kinase across 8 different inhibitors. And different combination of these resulted in 144 different delta delta G values. Here I'm showing the distribution of these values. As we can see here, we are classifying effectively as resistant mutations, all of the mutations that result in a 10-fold drop in the binding affinity of the inhibitor. So a delta delta G that is above 1.4 roughly kilocalories per mole. And this means that most of the mutations are actually not causing resistance, and there is a small subset of mutation causing resistance. So the takeaway message from these previous studies is that we should be able, at least for Abl kinase, predict resistant, the effect of mutation on ligand binding with an accuracy of roughly 1 kilocalorie per mole, and correlations that are moderate between 0.4 and 0.7 in terms of Pearson correlation, however, significantly different from 0. And this goes both for alchemical free energy calculations, but also from other structure-based models that were tested in the past, such as Rosetta and machine learning model with structure-based features, let's say. Now, soon after these studies, Marcus at Stony Brook was actually started collecting additional data for 94 different mutations of Abl kinase for 2 specific inhibitors, so Imatinib and Dasatinib. And so this provided the perfect opportunity to try and test these approaches in a blind prospective fashion. So what we received was a list of mutations, and then we tried to predict the impact on ligand binding. And here is the distribution on the bottom right hand side, the distribution of the delta delta G values. And similar to before, we have mostly mutations that do not affect that much the binding of the ligand, but a small subset that cause resistance. So the first interesting thing that we noticed here was that we had an overlap for a few of the mutations for these 2 ligands. So 21 shared mutations across Imatinib and Dasatinib. And as we can see, there isn't a perfect correlation. So on the x-axis is the one collected by Hauser et al. And we can see there is a root mean square error of about 0.6 kilocalories per mole between the 2. And if we split it by inhibitors, we can see that the correlation for Imatinib in particular is not that high. So there is a bit of a discrepancy between different experimental assays. And this is most likely because, of course, there is some random error in the assays, but also because effectively the nanobreath assay and the assay used by sort of collected from the literature, they really are measuring slightly different things. And again, this might be considered an upper bound on the potential performance of various approaches, even though, again, maybe speculating a little bit, I believe that the nanobreath is a biophysical assay that actually reports a bit more directly on the ligand binding affinity than the sort of Hauser-Gotzig assay that was based on cell viability. But if we go back and and look at the approaches that effectively we use to try and predict resistance for these mutations, we have 3 structure-based approaches, which kind of cover the spectrum of slightly more physics-based or slightly more data-driven. In terms of alchemical free energy calculations, we had two approaches: the non-equilibrium protocol that Christopher introduced before, that is based on GROMACS and PMX, and we use the amber force field in this particular case. This version 2, I believe, for the ligands. And Clara and Joe at Bayer, they also run Schrödinger's FEV plus with OPLS E3 force field. So another approach we used was Rosetta. So it's what we did here was to adapt a protein-protein interaction protocol that was looking at how mutation impacted protein-protein binding, and we adapted it for protein ligand systems. And as a last approach, we used a machine learning approach, like a fairly simple machine learning approach based on a variant of random forest, based on structure-based features. And these are things such as distances between the mutation and the ligand, a few physical characteristics and how these change when the mutation is, when the amino acid residue is mutated, as well as interactions between the presence or absence of certain interactions like hydrogen bonding between the ligand and the protein, and how these interactions might change with the mutation. So here I'm showing a quick overview of all of the results, but for simplicity, it might be best to focus on the red squares, which are basically the results for the whole data set of both imatinib and dasatinib together. And here we have three metrics that we looked at with all the caveats that have been discussed also in previous talks. So we have the root mean square error as a measure of sort of the absolute numerical error, and the Pearson correlation as a measure of the linear correlation. And the final one is the area under the precision recall curve, which is a measure of effectively how good the various methods managed to identify the resistant mutations out of the set of all of the mutations that we studied. And perhaps the first takeaway message is, again, the root mean square error is basically below 1 kilocalorie per mole for all of the approaches studied, with some variation. So again, machine learning did particularly well, but really, like all of the other approaches, if we consider this cutoff, this typical cutoff of 1 kilocalorie per mole accurate. And this is also sort of supported by the linear correlation. So when we look at the Pearson correlation, again, similar to the retrospective study, we have correlations that tend to be moderate but significant. So they are between 0.4 and 0.7 Pearson correlation, and they are significantly different from 0. Similarly, if we look at the precision recall curves and the area under it. So in this particular case, a random prediction would be at about 0.1 in a UPRC. So basically all of the, when considered the whole data set, basically all of the approaches managed to correctly identify a number of resistant mutations much better than you would find if you were to sort of randomly pick. Perhaps something else that could be noticed is that generally all of the approaches had a easier time predicting the effect of mutations on dasatinib than on imatinib. So like if maybe looking at the root mean square error, kind of the blue triangles tend to be below the yellow circles. Yeah, so I would say these are the main takeaway messages here. So what we wanted to do is also try to do some more analysis and trying to understand what are the pros and cons of the different approaches, which are, again, all based on structure. So here we're looking at a few different approaches and experiments, on the top left, and we're looking at the delta G values versus the distance. So the distance from the site of the mutation to the ligand. And this is, again, distance on the x-axis, delta G on the y-axis. And as you can see, there is more variability in terms of delta G when the mutation is close to the ligand binding site. And then it tends to, we have less and less variability when we go away from the ligand binding site. However, even up to 15 angstrom from the ligand, we still have mutations that can cause resistance. If we look at the Rosetta results, we can see that it's quite different in the sense that above, in terms of distance, we effectively predict 0 all the time. And all of the variability is really only for the mutations that are very close to the ligand. And this is understandable because Rosetta only runs very limited sampling around the site of the mutation. And so basically this protocol would have a hard time predicting anything that is far from simulation results. So in this case, I'm showing the amber results, but it would be similar for also probably FEV+ and other forces as well. We tend to have much more kind of a scatter of results, much more variability, also longer distances. So partly this is due also simply to the more inherent uncertainty in these predictions. But also, as I will show later, there is also the fact that actually with molecular dynamic simulation, one can capture longer range interactions. Machine learning is a bit halfway between the two in the sense that it tends to also predict, it kind of learns a bias for distant mutations. So it learns that it's kind of a safer option to assume that the delta G is slightly positive based on the training set. And maybe another interesting feature is that it doesn't predict basically no negative delta delta G value. So it thinks that none of the mutations would be sensitizing as opposed to resistant. So going back to distant mutations and simulation, here we can see one specific case where we have this mutation at the position 486. And this is this phenylalanine here, which is over than 10 angstrom away from imatinib, but still causes a significant. And this is a quite a challenging prediction for both Rosetta and machine learning. But here I'm showing the amber results where it's, at least the effect is predicted quite accurately, and one can also rationalize it based on structure. So, one can see that there is actually a network of amino acids such that the sort of the phenylalanine in this position, it can affect the affinity for the ligand when it is mutated to serine. So in this plot on the right-hand side, we're just looking at the interaction energy between imatinib and this I360 in particular residue, this isoleucine 360. And in this, at least in this preliminary analysis, it looks like that the mutation, the serine mutation, causes a shift in the dynamics of this residue, such that on average it has less interactions with imatinib. So that said, there are a number of mutations that turned out to be hard to predict for all of these. That the error is fairly large, over 1 kilocalorie per mole, and we're still trying to understand why this is the case. So if we look at imatinib as this is kind of confirming what I mentioned before. Imatinib was it was harder to predict the effect of mutations for imatinib than it was for dasatinib. Although this mutation in particular, which is known to cause resistance, was a bit challenging for both ligands. So here, Clara and Joe at Bayer, they've been trying to understand whether perhaps some modeling issues were underlying some of the sort of poorer performance for imatinib. So they with the neutral protonation state for imatinib, but this didn't really help overall. So for a few mutations, the results improved, but overall actually they were worse than with the protonated imatinib. And similarly, they also tried running alternative side chain protonation states for a number of different residues, but basically kind of invariably here in all the cases, this caused a drop in performance as opposed to be helping. But as I mentioned, there are still further tests and analyses that are ongoing. So this is very much kind of ongoing work. So if we can draw one conclusion from the analysis and the work so far, is that the prospective performance of structure-based methods and free energy calculations, but also the Rosetta and machine learning approaches is fairly consistent with what has been reported in the retrospective studies. And that basically means 1 kilocalorie per mole and linear correlations that are moderate, so between 0.4 and 0.7, but significantly better than random. And also quite a good classification performance in terms of ability to identify resistant mutations. So when looking at the pros and cons of the different approaches, at least sort of my takeaway messages would be these ones, and in the sense that machine learning predicted fairly accurate predictions at very low cost. But of course, training data was necessary. And this is the case for kinase and kinase inhibitors, but it might not be the case for new targets. And of course, since we are training on past data, the prediction also reflect biases in the past data. So like in this case, if we do not have sensitizing mutations, if we do not have delta G's below 0, in the training set, we will not predict delta G's below 0 for the test set. And this is certainly the case for the model that we trained, but it might also be the case for slightly more fancy machine learning models. If we look at Rosetta, it provided accurate predictions at a moderate cost. So if we, Rosetta still takes maybe 24 to 48 hours on a single CPU core. So it's still fairly cheap, in particular if you're running a lot of different calculations in parallel. No training data is needed. And perhaps one of the disadvantages is that for anything or any mutation that is above 5 angstrom from the ligand, one basically already knows that the delta G would be 0. Alchemical free energy calculation also provided fairly accurate calculation, but a much more considerable cost. It has the same advantage of Rosetta in the sense that no training data is needed, so it can be applied to completely new targets. And perhaps one advantage it has compared to Rosetta is that in principle, at least, it can predict and also help rationalize the effect of more distant mutations. So with this, I would like to thank again all of the collaborators at the Max Planck, Charité, Bayer, Stony Brook, and the Memorial Sloan Kettering Cancer Center. And I'd be happy to take any question.
All right. Thank you, Matteo, for the wonderful talk. That was excellent. We have a couple questions. So Julian Michel says, can you give us more details on how the machine learning model was calibrated and trained?
Yes. So in this case, we use the previous data from the Hauser training set as the data set as the training set. So basically, it's like a variation of random forest with 500 trees. The main hyperparameter optimization we did was effectively choosing the features. So the features were a large set of 128. Again, mostly geometric, like distances and angles between ligand and the amino acid residue, physical chemical properties of the amino acid residues, and also a bit of results from modeling. So what is the docking score for, we provided VINA features as well. And then we basically run cross greedy fashion, a set of features. And in the end, I think in this particular case, the model selected only 10 features. And the most significant ones were simply the distance between the ligand and the residue, and a couple of other geometric features, such as where is the sort of alpha beta carbon pointing towards, and a few of the amino acid residue, as well as I believe potentially whether a hydrogen bond was present or not in the wild type. So this was the main pipeline for the training, I would say. If that makes sense, I can provide more information, but so a fairly simple model, I would say.
Yeah, thank you. It sounds like he has a follow-up question. Was the fact that some mutations in the training set were also present in the perspective set a possible issue?
Yes, so this is exactly, so yeah, so there is an overlap between the two. So there is a bit of definitely a caveat. I believe potentially the plot as shown in terms of performance does contain this duplicate data. We also the duplicate data and the performance really doesn't change much. So it was not too much of a problem. Potentially also because we have this difference between the Hauser set and the new set in terms of using two different assays. So they are not perfectly correlated anyway. But yes, there is a bit of an issue there. And also we're trying to reanalyze the data in different ways. So without using the duplicate data tool and see how that would work. As well as trying to characterize a bit better the data efficiency. So how much data do we need before having a reasonably good prediction? So yeah, we're still doing that.
Great, yeah, thank you. And then there's two quick questions from the audience. So it says, can you tell us why a non-equilibrium protocol was used instead of an equilibrium method?
Yeah, so overall, this is partly is because we had a pipeline set up. So this is kind of the work I did with Bert and Vitas at the Max Planck, where we often use the non-equilibrium approach. As Christopher mentioned before, I think there are a few advantages potentially in terms of parallelization with the non-equilibrium approach, and also with potentially longer equilibrium simulations, because you are taking basically you are redistributing your computational resources away from the intermediate state and towards the end state. And so we decided to go for this non-equilibrium approach. Although, I mean, they should converge to the same result, but this is the main reason why we focused on the non-equilibrium protocol.
Perfect, thanks. And then last one, it says, did you get an X-ray structure of the mutant on the P loop not well predicted? Could there be protein reorganization, such as the loop popping up?
Yeah, so this is something that I believe Vitas is sort of exploring a little bit, potentially using different crystal structures as well. So that might be one hypothesis, yes. Again, it's still ongoing, but definitely could be one reason for the issues.
Great. Well, thank you, Matteo. We'll give you another round of applause. And thank you for your talk. And this brings us to the end of our workshop conference today. We'd like to thank all of the speakers who have presented today and everyone who's been helping on both the front and the back ends to make this possible, including all of our sponsors and Schrodinger for hosting the poster session. We'd like to invite everyone to return tomorrow for some more wonderful talks in science and hopefully, great discussions. So thank you all, and we'll see you tomorrow.
Thank you, Jonah.
Yeah, thanks, Matteo.
Thank you, Jonah.
And your other organizers.
Thank you, everyone.
Thanks.